Welcome to the recorded version of Challenges of Communication Between Older Adults and Their Children, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
Dr. Amy Dupree is the Executive Director of the DAI Foundation, a nonprofit organization established to meet the needs of caregivers. She is also the president of Dr. Amy Inc., a company dedicated to family caregiver wellness by providing access to information and education, services, support with emotional and family issues, and legal and financial support. She holds a PhD and master's in social work, specializing in gerontology, and earned her CSA, a designation for which she also trains others as part of their accreditation. And then joining us for the Q&A session today will be Mary Alexander. Mary is the Director of Business Relationships with Home Instead Senior Care Corporation. Mary actively manages strategic partnerships with companies, associations, and organizations whose products, services, and programs help franchise owners grow their businesses. She and her team's focus include long-term care insurance companies, hospitals, healthcare organizations, work-life balance opportunities, and senior industry leaders. And without any further hesitation, I would like to turn the floor over to Dr. Amy Dupree.
Great. Thank you very much, Steve. I really appreciate that. Hi, everybody. I'm Dr. Amy, and I'm a gerontological social worker, and I began working with seniors and their families over 25 years ago. I started first as a home care social worker and then held several other clinical positions. Since that time, I've taught in graduate and undergraduate social work programs and have taught and consulted with social workers and other helping professionals who work with seniors and their aging families. I've also spent the last several years writing and speaking to caregiving families and working with companies who want to better serve this market. And also, as important, I think, for this presentation, I've had the opportunity to be a caregiver to my own parents for nearly a decade. I want to start by telling you that I'm a huge proponent of the topic that we're discussing today, which is how to improve communication in caregiving families. Please note that although this presentation was originally developed for family caregivers, I think this information is just as applicable to us as professionals. And I'm sure as a professional, you're very aware of the communication challenges between caregivers and their aging parents. You know the impact when family communication is going off track or when it shuts down completely. So in this presentation, I'll focus on how you can help to open the lines of communication between family members or how you can improve the communication between you and your aging clients. Before I read the objectives with you, I'd like to share a story. And it's about a caregiver that I worked with. And I know this story will be familiar to many of you because you've had similar ones. She was very worried about her dad living alone, and she was concerned that if he fell down the stairs or in the bathroom, he wouldn't be able to get up to phone for help. She really wanted him to get a personal response system in case there was an emergency. However, the first time she mentioned it, he said, "I don't need anything like that. I've been on my own in this house for 5 years since your mother passed away. Don't treat me like a child." So she didn't bring the topic up again for months because she felt a bit intimidated by this. Then one day she heard a story from a neighbor about an elderly woman on her street who had a fall and was alone on the floor for hours until luckily somebody dropped by to check on her. So this caregiver decided to try to talk to her dad again, this time with a different approach. She told her dad the story about her neighbor and said, "You know, actually, Dad, it would really make me feel better if you had a personal response system. I wouldn't worry so much." After a few more conversations, her dad agreed. I think we know that sometimes aging relatives will respond if a family member shares about the impact something has on them. And by trying that approach, a little different twist, many times people will respond because they want to do what is easiest on their loved one. I actually found this approach often worked with my father when he was feeling like he didn't want to do something. I would say, "You know, Dad, this would give me peace of mind." And it's a communication strategy that I think works really, really well for people. And again, I'm sure you've heard some very similar stories.
During today's webinar, we're going to look at that kind of thing because we're going to learn when and how to open the lines of communication with your caregivers and aging parents. And then we're going to discover what topics are the most difficult to discuss and have methods to approach them. We'll talk about how to understand the key barriers to communication and how to overcome these barriers. And finally, we'll talk about how you can get additional resources for assistance. I know that many of you have been out in the field for many years, and while some of this information may be very familiar, it's a great opportunity today for all of us to get a refresher on some helpful communication strategies. As you know, for many adult children, talking with their aging parents seems to go in a full circle. When they were younger, there were mutual feelings that nobody knew anything. Nobody understood each other, and both sides got pretty frustrated.
But as adults, usually that tendency ebbs and flows, and both sides learn to eventually respect and accept each other's adult opinions and decisions. But then, something happens often as people age. All of a sudden, it can be back to a misunderstanding or a frustration or not even communicating at all. And we see often that this grows. So in a worst-case scenario, sometimes people start out with small disagreements or annoyances, but if they're not addressed in the beginning, these can often result in arguments or in a complete lack of communication that can destroy what often is the last precious months or years together. And so people lose this really precious time together. There's a great book you may know. It's called How to Say It to Seniors, and it's by author David Soley. And he says these communication breakdowns occur in part because the needs and developmental tasks older parents face are very different from and often even conflict with their adult children. And I think that makes sense if you think about it, that people are at different life stages with different needs, and they don't even recognize these different needs, and often they get in the way. Understanding these differences and learning to manage them can result in positive, constructive, and healthy conversations between seniors and their adult children. They don't have to stay in that place of not communicating well. And I know as a professional working with seniors and their caregiving families, you can help by understanding and recognizing these differences in developmental tasks and then teaching families about those differences. Because again, most people aren't even aware of those developmental tasks and how they impact communication. Of course, once we understand the impact of these differences, it's also helpful to offer suggestions to families for alternative ways to communicate that and to create more effective and more harmonious communication for everyone. So we have to really model and teach this to the families that we work with. And if you're like me, if you also are a family caregiver, you'll have to remember to do it all over again in your own family, because what it's so easy to teach other people and to model for other people is not nearly as easy to do when we're doing it with our own families. At least I have found that, and in talking to other professionals, they've told me the same thing. Today what I'll do is I'll give you some tips to open these lines of communication and also reminders of which topics are the most difficult to discuss. And then we'll talk about some methods to approach these. I'll also go over some of the common barriers to communications and ways we can overcome those. These techniques will help you communicate more effectively with your senior clients, and it will also help you to help them have more effective conversations with their caregiving families. So really this has a benefit in many, many ways. So let's start talking about what these communication issues are. As adults, we all learn to communicate with a lot of people in a number of situations. But for adult children, talking with their parents about sensitive topics, and these include things like failing health, driving, finances, and living situations, these conversations can be very tense. The fact that many seniors may still be dealing with their grown sons or daughters as if they're children, and I know you've seen that, rather than as adults, makes these conversations particularly difficult. And what's interesting is that works both ways in my experience, is that the senior often is treating their adult children as if they're still children, but when they do that, the adult children often respond by behaving like children rather than the grown-ups that they are. And often it gets to be a dance that goes around that they don't know how to get out of. We know these aging issues, though, need to be addressed by families. And it's better to broach these topics before a problem arises or there's a crisis. Now, we all know that, and we also know that most families do not talk about these things until they're in the midst of crisis. So there's a good rule of thumb, and that's for adults to start talking while their aging parents are still pretty healthy and there are no apparent concerns. That's not when people usually do it. They wait till there's a crisis. So Home Instead Senior Care recommends something called the 40-70 rule. The idea of this is that if you're at least 40 or your parents at least 70, it's time to start talking about some of these issues. Now, these conversations can be held over a period of time. They don't have to be done all at once. Not all topics have to be addressed in some big powwow, but they do need to be talked about, because I'm sure you and I have all experienced what happens when people don't have these conversations ahead of time. They get into decision-making during crisis, and then they often regret the decisions they make or feel uncertain about them. So can't tell you how many clients I've worked with who said, I wished we talked about this ahead of time. I'm currently doing a lot of speaking on this topic, and I make this recommendation all the time to families. And I have to say, it's the thing people comment the most after my presentation is either they wish they had done that with their aging parents, or they were going to go do it because they now understood the importance of it. So I think we as professionals really need to stress this 40-70 rule and how to help people have these conversations. People just aren't used to thinking about the idea they have to talk about these issues ahead of time. It sort of goes against the grain. And I have found that sometimes the people who resist this the most are the adult children, not the seniors. Because the adult children will say, why do we need to talk about this now? There's no problem going on. And that's what I always say is, well, that's the time to talk about it. You'll be happier in the end that you had these conversations. So again, I think as professionals, we really need to encourage families to talk early about these issues and on an ongoing basis, because if they can start setting up healthy communication around this, I think they'll find that it gets easier and easier for them. And again, the 40-70 rule provides a good basis for getting people to understand the importance. Now, starting these conversations can be done by simply making time to listen. I think this is good advice for family members as well as for all of us in the helping professions. So what do I mean when I say simply making time to listen? Well, we know we're all very busy these days, and one of the biggest challenges in dealing with anyone, and especially with seniors, is to slow down and to find the time to be fully present and listen. Family caregivers should not try to discuss important issues when they're driving to a meeting, helping the kids with homework, or feeling rushed and preoccupied with other issues. These issues are important enough to make them a priority. That's true for us as professionals, and it's what we need to encourage families to do. Now, talking about these crucial issues means taking time, being patient, and recognizing that solving any of these issues will probably require more than one discussion. And I think those are things we need to stress with busy caregiving families. Often their expectations are that they can manage these topics in one conversation. And that's not realistic, and we need to help them to understand that. And I'll share with you a story from my own caregiving experience about where I found that. My parents, after my mother had a massive stroke and was unable to make decisions for herself and really lost her ability to speak, my father was the one who was deciding for the two of them, and he often found that very stressful. And one of the issues that we had to address a number of times was their housing, where they lived, the needs shifted over time, and it was very hard for him to recognize when there was a need to move to a different living situation. And what I found was I had to have numerous conversations with him over a period of time before he could accept the need for the change and feel comfortable about it. And oftentimes I did that for weeks, and in one case it took me 2 years before my father really was ready to make a move. And the last time that happened, I moved my parents into a facility that was really an independent living facility with a lot of supports. And they still needed home care in that facility as well because of my mother's needs were so great. But my father resisted that move because he felt the place was too small, even though he saw the benefits of it being attached to my mother's daycare program and that there was a better community for him. And so over time, I just had conversation after conversation about why I thought this would be in everyone's best interest, and especially my mother's. And again, he then had time to accept that decision, finally be ready to make the move. And after he made the move, they made the move. About 6 months later, my father and I were talking, and he said, you know, this was the best move we've ever made. And that made me feel so good because it was his decision, not my decision, and forcing it on him. And I think we need to remind families these things can't always be resolved in one conversation or even two or three. I think the other thing we need to remember is it's important for all of us to go into these conversations with an open mind and to be open to other options. As professionals and as family caregivers, we often think we have all the answers, but we need to be sure to pay attention to the seniors' ideas and fears that they may either express directly or indirectly. We know that generally older people understand far more than they express, so it's important to understand their thoughts and listen for deeper meaning. That may seem obvious to us as professionals, but I have to tell you, I've worked with lots of professionals who really didn't take this approach with families. And again, I had this situation occur with my mother when she was recovering from her stroke. She was in a rehab facility for a year, and I was working diligently to get my mother back home with my father. And the staff was really resisting my doing that, and they were holding regular family meetings with me. And I used to joke that I knew they were having the meeting before the family meeting because they all came in clearly having had a conversation about how to convince the crazy adult daughter that she should leave her mother in this facility. And I, a number of times, got very frustrated and twice ended up in tears because they were not listening, that the family was clear we wanted to bring my mother home and we needed their support as professionals. And finally, I ended up just taking the control and arranging all the services and doing everything. My mother lived successfully at home for 7 years with major disability. I knew we could do it. I knew the family was committed, and we actually fought the professionals in that facility on that. So I speak both from the professional voice and the family on that we have to really watch our tendency to think we know best. And we all know that family members often think they know what's best for their family members. Oftentimes family members think they have the solution, and so they don't really take the time to listen to the senior. They don't really take the time to hear that there might be other options. So I've seen this happen, and I'm sure you have, when a family member notices something like their parents having a hard time taking care of the house, or that their personal grooming's changed since a spouse passed away. Oftentimes the adult children want to jump in and start talking to their parents about, why don't you move closer to us? Or why don't you move into an assisted living facility? And frequently the parent really wants to stay in their own home and might be very willing to consider hiring someone to come in to help for a few hours each day, or be willing to make safety improvements around the house. Being receptive to what parents or clients have to say can really go a long way towards opening these lines of communication. If they're really intent on managing on their own, we need to encourage family members not to argue, but to try to find solutions that work for everyone. For example, if someone's offered to help the senior family member with finances and then the person refuses, it's a good idea to suggest maybe they would be willing to consult with a professional on this, such as an accountant, instead of having a family member involved. Another thing you can encourage your caregiving families to do is to actively listen, to pay attention to their aging family member's mood. Make sure they're feeling well, awake, and engaged. Remind them that just like the rest of us, if we're in a bad mood or we're not feeling well, the last thing we want to do is have a serious conversation. So even if the family member comes in thinking this is the day to do it, we really need to encourage them to read the mood and to be willing to put off a discussion for a better time. If there seems to be an impasse, the best thing we can do is to clear the air. Family members can express their frustrations quietly. They don't need to shout. Chances are the senior's feeling the same way, and clearing the air may help everyone find some common ground. So this isn't about everybody holding in their feelings, but it is about finding a healthy way to express those feelings. Sometimes the best solution during a disagreement, as we know, is to back off. You may see situations where family caregivers continue to badger their parents, but we know that only serves to alienate them and increase frustration all the way around. A much better approach is to stay positive, to keep in touch and to offer to help again and see when the person may be more receptive. Okay, so now that I've talked about when and how to open these lines of conversation, let's take a look at some of the most difficult topics that we know families have to discuss. As you know, some of the most difficult topics that people have to discuss with aging loved ones are things like moving from their home, finances, driving, and health issues. So let's take a look at each of these topics in a bit more detail from the perspective of both the family caregiver and the aging person. So first scenario. From the adult child's perspective, they recognize that their parents have lived in the same house for over 40 years, and it's full of memories of a happy life that provided comfort. But they also know their parent has fallen twice over the last few months, and every time the adult child suggests a move from the family home, the subject gets changed. Now, that's the perspective of the adult child around this issue of moving. Research shows the most difficult topic for adult children to discuss with their aging parents is that they have to leave their home. The first thing to consider is that both the adult child and their parent are experiencing the subject of leaving the home differently, and this is part of what we need to remind families. So for the adult child, this often is, what do we do about mom and dad? And it's become sort of a checklist item on their to-do list. So when they're visiting, they're worried because they're noticing that their parent is unsteady when they're walking, or they raise the issue again of the assisted living facility nearby. And then the parent goes down the trip of memory lane of, but I love this house and I've been here so long. So the adult child feels their parents being stubborn and uncooperative, and they wonder, why can't they just deal with the issue? But for the aging parent, several things are going on at the same time. First of all, there are probably control issues, and the thought of giving up the lifelong home may just be too much to contemplate. At the same time, they may really dread the thought of going someplace where everyone is unknown and also having to follow somebody else's rules and schedules. Given all these doubts and fears, for them, it may just be easier to avoid the conversation. Okay, so second one. Of the difficult topics, 21% of adults say that money and finances is near the top of the list of challenging subjects to bring up with older adults. So let's look at another scenario. So in this scenario, from the adult child's perspective, it might be that both of their parents are getting increasingly frail and forgetful, but they're refusing to let their sons or daughters help with bills or other practical matters. Now, the siblings may all agree that their parents need more help. They volunteer to take over the finances, but the parents insist they can handle the bills. One of the sons or daughters may notice that on their last visit, the desk is in disarray, the bills are buried in papers and books, and when they ask about the bills again, the parent says, "We're fine, dear, we really don't want to be a burden," and the child is left wanting to tear his hair out. So what aging parents understand is that their years of independence are numbered. And life as they've known it seems to be disappearing for them. It's just retreating into their memory. Given all the changes they face, they're trying to cling to areas of life they can still manage. They appreciate their kids' concern, but they also often find it a little insulting. They see it as doing the best they can, even if it's not up to their kids' high standards. And I'm observing this right now around a move scenario and money with a dear friend of mine and her aging mom, and I spent 3 days with her aging mom, who over and over talked about the fact that I can still do this, and that she was a little frustrated by her daughter's interference. And she said, I appreciate her concern, but she's treating me like a child. So again, these are real things we know that come up over and over again. Driving, the third issue, is another hot button and often a really difficult topic. 30% of adults say that raising the issue of their parents losing driving privileges is the most difficult subject for them to address. And you may have heard there was a lot of press on this week with the National Transportation and Safety Board being in Washington, and there's a lot of discussion around this right now on the news. So here's a third scenario. Again, from the adult child's perspective, they may have something like this happen. A neighbor of their parent may call them and tell them that he's witnessed seeing their parent back into their car into a light pole. Now, before this call, the adult child probably recognized there were issues in the driving pattern. For example, they may have noticed their parent even isn't driving as much because they're not comfortable driving in the evening. So now they have more evidence, a neighbor. On the next visit, they may point out the damage and say, I'm worried you're no longer safe on the road, and I'm also worried that others could be at risk as well. Now, often the immediate response to that is defensiveness. And now the daughter may be left with mixed emotions because in some ways she knows her parents acting responsibly, but she's still worried about the driving and what this means. The senior perspective. We know that for all of us, driving represents freedom and independence, and that's just as true for seniors as it is for us. We know that with the car, they have the ability to go visit friends, to go out, to go shopping. They don't have to rely on somebody. And, of course, if people live in a remote area, they may not even have access to public transportation. For someone who's already feeling like a burden and who's already feeling like they've had to give up activities due to age, this is likely to be seen as one of the hardest and most constraining issues. Other difficult topics to talk about are health issues and the implications that has on so many areas of people's life. So let's take a look at a fourth scenario with this, and again, from the adult child's perspective. So potentially the child is visiting his 85-year-old parent, and the son sees bottles of medication on the kitchen counter, then he goes in the bathroom and he sees medication on the counter, then he goes in the bedroom, he sees medication on the nightstand. He wonders, how is my dad keeping all of this straight? And then he notices for the second time in a short period of time, his father forgets the name of a close friend. The son wonders, is this Alzheimer's disease? Is it dementia? Is it just a senior moment or some passing phase? And most importantly, he wonders, how do I even figure this out? Out of concern, family members may start offering suggestions for things like pill organizers and doctor's visits to check on memory capabilities. And what a parent hears is that they're being treated like a child. They think there are good reasons why some of the medications are in the kitchen because they're taking them with food, while others are on the nightstand because they're taking them before bed. And they think, well, I've always been bad with names. So they see their child as overreacting. I'm sure you recognize or have experienced these types of situations with caregiving families, and maybe even in your own family. In each case, you can see it's difficult for both parties. But talking about these things really does not have to be impossible. So let's look at some methods of how to help families approach these delicate subjects. There are a number of things for all of us to keep in mind when talking with seniors, both as professionals and the caregiving families we work with. I hope you'll find these things to be good reminders for you and things, again, we need to both model and teach to the families we work with. We know that being cognizant about our approach and speaking methods will go a long way towards successful communication. For instance, when talking with seniors about any difficult topic, it's important to always try to move towards solutions that provide the maximum amount of independence for the older person. And not just to do that, but to state that as being the goal. So look for answers that optimize strengths and their desires. For example, if the senior needs help at home, look for tools that can help them maintain their independence. For example, professional caregiving services can provide assistance in a number of areas, including meals preparation, light housekeeping, or medication reminders. And again, this conversation really needs to be about what's in the best interest of maintaining independence for the senior, and what is it that the senior wants. Another important approach is to remain respectful and not patronizing. Now, I know that may sound obvious, and we all are probably nodding our heads saying yes, 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 but I really believe we need to model this for families and for other professionals because my experience is that many professionals forget this. We need to remember we're talking to an adult, not a child. And I have to tell you, I experienced this countless times with professionals when they were talking to my mother, who lost almost all of her speech capability in a stroke. Often they would talk to her like she was about 5 years old, or they would shout to her. I would have to remind them that she had lost her speech, but that she could completely understand them. I saw my mother's expression completely change when they started to address her again like an adult. And I would often say something to them like, my mother can't respond, but she really does understand everything. So you may witness it with professionals, or you may see family members using patronizing speech or baby talk. And we know this just puts older adults on the defensive and conveys a lack of respect for them. I have to tell you that I also witnessed this often in a hospital setting with my father. The 2 or 3 times my father ended up in the hospital, I watched staff talk to him in a very patronizing way or ignore him entirely. And I think, again, we have the responsibility as the professionals on this call to be monitoring not just what's happening with families, but also with other professionals. So the way we can do it with family caregivers is to really encourage them to put themselves in their parents' shoes and think about how they would want to be addressed in the situation. Also, try to remind family members that not everything needs to be solved right away. If the person receiving the care becomes angry, tell them it's best to drop the subject, return to it another day. If there's continual disagreement, family members really shouldn't force the issue. As long as the senior is not cognitively impaired in a way that causes safety concerns, no one can force them to follow their advice, no matter how right someone may think that advice is. I often remind family members that we all make decisions that other people think are bad, and that is really our right as fully functioning adults. When I'm doing this in a workshop setting, I will often say to people, I'd like anybody who has never made a bad decision in their life to please raise their hand. And everybody kind of chuckles uncomfortably because we all recognize that we have made decisions in our own life that maybe weren't the best. And I think, again, this is a way for us to get people to realize that just because we're older doesn't mean we're always going to make decisions that everybody loves, and we need to help family members back off a little bit. I want to share with you another communication method that some of you may be familiar with. I like it because it helps family members be thoughtful about their approach to important conversations and gives them easy-to-understand guidelines that they can go through before having important conversations with their aging family members. This communication method is called T.E.M.P.O, T-E.M.P.O, which stands for timing, experience, motivation, place, and outcome. This comes from a website, which is Talk Early, Talk Often. You see it there on the bottom of your screen, and I really recommend you might want to take a look at that. This is another method that you can share with family members to help ease communication challenges. So let's go through each of the 5 so we have a better understanding of what that's about. T is for timing. First, time the conversations appropriately. Make sure that the senior adult has time to talk and isn't distracted by needing to get to an appointment or wanting to watch their favorite program. So this is really about being respectful for the timing of everybody. Also, suggest to family members that they make sure they've really got the time to listen, that they're just not running in and out of the door, as they're 5 minutes before leaving is not the time to start a conversation. We need to remind them that talking to aging parents really requires an investment of time and patience. Second is the E, which is experience. Family members really do a better job of opening the door to talking to loved ones if they can tie their specific topic to some direct experience either they've had or they know that someone's had. For example, if they've just finished updating their will, they can ask their parents, when was the last time you had a look at your will? Or if their friend's father just had a heart attack and it took a long time before the hospital could notify him, they could ask their parents, have you looked at your emergency information lately? And I'm wondering if I could just see how it's organized so if there was an issue, I would just know where things are. Or if family members are refusing to ride with their parents anymore, they can say, I'm concerned about how you're doing with your driving, and that's why I'm not really willing to ride with you anymore. Again, tying it to something specific helps have relevance. So the M is for motivation. Encourage families to be clear about their motive for asking to have a conversation. If a family member is annoyed, frustrated, or angry, this is not really the time to engage in an important conversation about the future. We need to remind them that when they have a conversation, the motivation really needs to be solely for the safety, well-being, and quality of life for both the care recipient and the caregiver. I often say that that aging issues are dealt with in the context of family. It's not about making the aging family member's needs paramount. It's making sure everybody's needs are addressed, but recognizing that this issue of safety and well-being and quality of life are key for everyone. Okay, the fourth is P, which is place. This is about having family members create a safe space to have important conversations. So I joke about this, but I've heard many stories about this. The holiday dinner table is not the time to talk about sensitive topics around aging. And often people do this because they're together for the holidays, and they think, well, while we're together, we should deal with this. It becomes a practical issue rather than what's best emotionally for people. So really thinking about this is key. It might be good to have it outside the house at a nice, quiet restaurant, and then there's a little bit different atmosphere. Or, again, somewhere that makes the senior feel safe, emotionally safe, and that the conversation will stay in a positive tone. A safe place may be in the company of someone, like a trusted family member or friend. If that's true, be sure to include that person in the conversation. Now, the reverse of this is also true. If there's a family member or a friend that is likely to agitate a situation or cause frustration, they should not be there. And the other thing we need to remind family members of is that oftentimes seniors feel that they're being ganged up on if there's a whole team of people to come in and talk about an issue. So thinking about who's sitting there is very key, and where that is, the place is key. And then the O in this case is for outcome. So you can remind families, but really what they're trying to do is to encourage not a one-time conversation, but an ongoing, honest conversation about everything related to the older person's future. So given that, the goal isn't to get everything answered immediately. Rather, it's more about laying groundwork to understand the person's feelings, wishes, and needs. So the goal is really to get and share information, and families need to trust that will happen bit by bit over time. Again, not something that happens quickly. So recapping, T.E.M.P.O, timing, experience, motivation, place, and outcome. If we help families work to make all 5 of these items comfortable and positive for their aging loved one and for themselves, they're bound to have more success. Okay, so next I'm going to discuss some communication barriers and how to overcome them. So barriers to communication certainly exist. You see them every day as you interact with aging families, but there certainly are ways to overcome them. Now, as we know, age-related decline in physical abilities often make communication more challenging, and some illnesses make communication difficult. Families don't fully understand what is happening, and they don't often understand how to compensate for these things. So again, we need to model and teach these things. One of the best examples is the first thing on your screen, which is about hearing loss. As we know, hearing loss makes it much harder to understand. So we need to remind family members they have to be patient, and then we need to help them have skills for better communicating. Often people feel they behave as though someone with a hearing loss is doing it on purpose. And we need to remind them that just like wearing glasses, that the person isn't not seeing on purpose, they're also not hearing on purpose. And you'll hear families talk about things like selective hearing on a regular basis. So, again, understanding that's key. So some of the skills people need: speaking more clearly, remembering to face the person when they talk, being aware of talking on the cell phone and that reduces clarity, and avoiding talking while eating. If hearing aids are out of the question, you might want to talk to families about an assisted listening device that could improve communication over the phone. We need to remember that hearing loss is the sensory change most linked to depression and social withdrawal, and we need to share that information with family members because they don't understand that. Another barrier is vision loss. Vision loss makes it harder for the elderly person, obviously, to recognize people, but it also, we know what goes along with that sometimes is changes in speaking ability. So we have both vision loss, hearing loss, and the speaking issues. And people's voices get weaker or harder to understand. Again, this is an issue of patience and being aware when the elderly person may need to get some more rest if they're tired. Some age-related memory loss we know is normal as people get older. Probably a bunch of us are experiencing a bit of that now. And most often it's our short-term memory that is impacted, which makes it hard for the senior to remember the recent stuff. Families need to also understand that it may not just be that going on, but that people have a hard time cognitively multitasking as they get older. So they should try to avoid talking about multiple topics at the same time. Being more linear is helpful. And finally, you see the last barrier on the screen is really about the continuance of the parent-child relationship. You know, for most of us, when we hit midlife, it's really a time of independence and mastery. And that's where most adult children are. They're in that stage of feeling confident, knowing their values, and feeling good about their responsibilities and what they're doing in their life. At the same time, we know midlife is a time people start nurturing and giving back more, whether it's by having children or engaging in mentoring or some sort of giving back to other family members. We know that people in midlife tend to move through the world quickly and efficiently. We get through our tasks quickly. We take care of lots of responsibilities. We're looking ahead to the next mountain to climb. We have to help our family members understand, our caregiving families, that their aging relative is not in that phase. They're more in the phase of letting go of duties and responsibilities and settling into retirement. And they're also in the stage of maybe dealing with some independence issues or physical health issues, things like that. They're looking back. They're trying to understand their lives. They're trying to look at their legacy, what they're going to leave behind. It's these different perspectives that can often lead to breakdown in family communication. Helping families understand what's going on in that way can really help them close that communication gap. Now, we know there are some aging people who just refuse to communicate. They don't want to deal with the issues at hand. The best we can do is just practice patience and try not to get frustrated. And we can encourage family members to enlist support of professionals and other friends and understand that it may not go perfectly. But I think by having a better grasp on these barriers and ways to overcome them, we can really go a long way to helping family members improve the communication. I talk a lot about the idea of caregiver wellness, how to take good care of an aging family member at the same time you're caring well for yourself. And communication, effective, harmonious, compassionate communication is a big part of this. I hope that as we went through all this, you found something in here useful, both in your work with older adults and to model and to teach to caregiving families. There's a lot of information covered in this particular topic, and I'm hoping that what you'll do is step back and ask yourself where you see the challenges, either in your own practice, in working with aging folks, or in their families, and to think about what's the next step for you. How can you help families open up the lines of communication, perhaps by using T.E.M.P.O or by being more aware of these barriers. I want to thank you for joining the webinar today, and we're now going to open the line to questions. So I'm going to turn this back to Steve so that he can manage that.
Thanks very much, Dr. Amy. Once again, another very informative presentation. Joining us for the Q&A session right now is going to be Mary Alexander, who is the Director of Business Relationships with Home Instead Senior Care. So welcome, Mary, and thank you, Dr. Amy. Let's jump right into the questions. Okay, we have a question. This one is for you, Mary. I work with a lot of families who don't see eye to eye when it comes to caring for their parents. Are there any resources available to help families work through their differences so the parents can get the quality care that they need?
Thank you, Steve. You know, that's a question that we hear a lot, and one that I have both professional and personal experience with. My mother recently went through an illness, and with my other siblings, you know, we all felt as though we had to do it our way. The reality is it needs to be done my mom's way. And so I think that led us to going down a path where we had to find resources specifically designed for sibling dynamics. And Home Instead Senior Care is going to be bringing a program specifically on sibling dynamics and how to maneuver through caring for your parents at the first quarter of next year. So we'll keep everyone's information handy, and if they're interested, we will send that up to them.
This question is for you, Dr. Amy. Are there ways to recognize that an elderly parent is not healthy any longer during normal conversation?
That's a good question. Yes, certainly there are ways. It's hard to do it solely on the phone, although certainly there are cues. And when you say healthy, I'm assuming we're talking about both physical health and cognitive health. I think, we certainly become aware of people's cognitive shifts as we listen to conversation if they repeat themselves consistently, and not just as an occasional thing, or if they start forgetting that we called, or they start having clearly some, beyond just memory loss, some confusion that's concerning. That's something we certainly want to address. And then listening to their mood, because I think one of the things we often forget about is, again, the issues of depression and anxiety. We talked a bit about that on the last one, that, we need to be aware those can be issues. So listening to people's mood, if they're crying frequently or sound down and depressed a lot or very anxious, we don't want to ignore that. And asking them directly about how they are. I think, a lot of times we hesitate to just be natural and human, and I think part of why seniors resist us talking about it is because we don't reassure them that our goal is to help them maintain their independence for, in whatever way possible. So I think they often, we adult children start to be seen as the enemy rather than as the ally. And so we want to help switch that and get family members back to being allies by encouraging open communication and saying, Mom, I just want you to know I'm here to help you stay independent. That's my goal too. So sometimes I'm going to ask you things, and it's not because I'm checking up on you. It's because I want to make sure we don't miss anything that might get in the way of you being independent.
We have been talking a lot in this presentation about adult children, but I'm wondering if one of you can speak to the growing non-traditional population regarding older adults who don't have children or whose children live far away.
Well, I think I was one of those adult children who lived far away, by the way, and what I know in working with lots and lots of long-distance caregivers is they're often incredibly engaged in the caregiving situation. So even though they're not there day to day, it doesn't mean they're not arranging care and checking in on a daily basis maybe and doing all of that. But your other part, Steve, which I think is key, is about the non-traditional. We have lots of people who don't have kids, and my experience is that many, many people without children have lots of other people engaged in the caregiving. It might be friends who might be a bit younger or just healthier. It might be other family members, nieces or nephews. It might be a spouse or a partner. So there's lots of other people involved in caregiving. And again, these techniques we're talking about work equally as well. What you may not have is that same parent-child dynamic going on, but still those similar dynamics. I have worked with lots of caregivers who are caregiving for friends, and there are still things that have to be addressed in a very sensitive manner from a friendship standpoint. So I think we're going to see a lot more of that, and I think it also speaks, Steve, to the need for really good partnerships between professionals and families. I'm a huge proponent of this. I think we need to encourage families to not go it alone and seniors to not go it alone. It is not a failure when a family or a senior hires someone. I always say the goal is to make sure the best care possible gets provided, not to provide all the care yourself. And a lot of times it is really much more effective to engage professionals in the caregiving as well.
Okay, great. Another question for you, Dr. Amy. We've got a great question here. Maybe you can impart some of your personal knowledge that you were talking about earlier in your experiences. Do you have any suggestions for how to help children who are becoming caregivers yet are feeling guilt and awkwardness with the role reversal between the parents and children?
Yeah, that's a really great question. One of the things that always makes my hair stand on end a bit is when people say, I'm parenting my parents, because we never parent our parents. They always are our parents. It would be easier if we could just parent them because we could step into that parental role. But the truth is there's always the parent dynamic, unless somebody ends up with major cognitive issues and they're not able to function as an adult anymore. That's obviously a different situation. I talk to people a lot about treating your aging parent, or again, anyone in that position, with great respect and like you would want to be treated yourself. So I think we can almost, instead of thinking about it as a role reversal, just think about it as, how do we provide nurturing care for someone we love dearly? And I think in the dynamic of the parent-child in this, that this is where we can have hopefully open conversations with our parents and say, this is a shift for me too, and I'm trying to figure out how to do this while maintaining our relationship in a similar way. I want you to know that I love and respect you and will always love and respect you, and I want to be there for you. So I'm not trying to take over your life. I think, again, reassuring people we're not trying to take over their life goes a long way. Now, I'm not sure what was meant by the guilt in this. What I know is every caregiver I've ever worked with has experienced guilt at some level, either for not doing enough, for doing too much, for not, for ignoring other parts of their life. I think good social support really helps on this. Having other people who understand what you're going through makes a huge difference. Not trying to go it alone emotionally is a big part of that, because often we're not very good at assessing what's happening because we're so close to the situation. So talking with other people, either in support groups or just good friends of ours. I always say somebody who's not engaged in the caregiving with you. So even though siblings can be a great support, they've also got their own issues going on.
Okay, looks like we've got time for just one or two more questions. Mary, this one's for you. There are so many resources available. Where do I start when I need information specific to caring for my parents?
Steve, there are a number of resources out there, and I think it's important to know which direction to go. So I'm going to give you a couple of areas to focus on. First, I would encourage you to visit caregiverstress.com. It has a number of valuable resources that can help you maneuver through this journey. Everything from how to communicate to your parents, like we talked about today, to home care resources, to nutrition. And it's a great place to start. The second area I would say is talk to others. Other people are going through similar situations, and sometimes it's good just to get their perspective on it. You can also go to your HR department or your employee assistance program at work, but really talking about it is very important. The third area I would recommend is there's a book called Stages of Senior Care that our founders, Paul and Lori Hogan, wrote. It's that book, What to Expect When You're Expecting a Baby. It's the equivalent to what to expect when your loved ones are aging. And then fourth, I'd say find a professional. Find a local agency or office on aging to help you find local resources and where to start to have some of this dialogue. But there are plenty of free resources available, not only in your community, but online.
It seems like we are just about out of time today, and wow, we have gotten a lot of questions in, but I do want to let you know we were going to be following up with the folks whose questions that we didn't get to, so I just wanted to let you know that. I want to thank Dr. Amy Dupree and Mary Alexander for Homestead for their presentation today. Very excellent. Thank you both.
Thanks, Steve. Glad to be here.
Thanks, Steve.